Hi team, welcome to my YouTube channel. With you here is Shannon. We are back with another video today where we are going to look at a very interesting topic that we find in surgery and surgical nursing. So before I even introduce the topic, as usual, don't forget to subscribe to my YouTube channel, hit that notification bell so that the next time I'll upload more lessons, you'll be notified and you'll be able to learn from those lessons. So if you have a question by the end of the session, don't forget to ask in the comment section. I'll be able to attend to it. Yeah, so that is that. You can also like the video, share it with your friends, you can download it, listen to it at your own free time. Yeah, so getting back to our topic of discussion today, we are going to look at the process of inflammation. So we've got some few phases that are involved in this process. Not only that, we also need to define it. Maybe you don't know what inflammation is. It will be vanity if you listen to the process of inflammation without knowing what inflammation is all about. Yeah, so in defining inflammation, we are saying this is just the body's response or the tissue's response to injury or infection that may invade the body. Yeah, so that is that. So this is just the tissue's response to any injury or any infection that may invade the body. So now going to the stages that are involved in the process of inflammation. So we've got 4 phases. The first one that we have is vascular response. The second phase that we have is cellular response. The third phase that we have is exudate formation, and the fourth phase that we have is healing phase, which is the last phase. Yeah, so we'll begin with the vascular response, which is the first stage. So vascular, we are focusing more on the blood vessels, what really happens within the blood vessels when somebody has encountered an injury. I would give an example. Maybe I happen to have a cut on my arm. So the first thing that will happen, the first reaction that will take place, it will be within the blood vessels. So immediately I have encountered or happen to encounter that injury, my blood vessels are going to constrict for a short period of time. So we call that transient vasoconstriction. So they only constrict for a short period of time, maybe seconds or so. So after that constriction, we find that there are injured cells surrounding that injured site. So those injured cells will be irritated and they'll begin to produce some chemical mediators, of which we've got histamine, we've got nitric oxide. So what do these chemical mediators do? So these chemical mediators are going to go to the blood vessels surrounding the injured site and they'll begin to dilate them. So histamine is a powerful vasodilator. So blood vessels will begin to dilate. And once the blood vessels dilate, we find that the pore spaces within the surrounding blood vessels will begin to open. And when the pore spaces open, there will be shift of fluids from the intravasation to extravasation. So fluids will be moving, blood will be moving away from the blood vessel, going to the surrounding tissue. So once that blood reaches the surrounding tissue, we find that there will be edema. There will be some swellenness occurring within that injured site. Not only that, there will also be hyperemia, which is redness. So there will be redness because of the accumulation of blood within the surrounding tissue. There will also be heat due to that increase of blood running to that injured site for the purpose of trying to quicken up the healing. Not only that, we also have pain. So pain is going to come in due to the irritated nerves that have been injured on the surrounding injured site. Yeah, so we find that all cardinal signs and symptoms of inflammation are going to appear within this first phase. So not only that, we also find that healing will not take place and will not even go to the next stage if at all clotting does not take place. If bleeding continues, we won't move to the next stage. So bleeding needs to stop. How is bleeding going to stop? So we find that there will be some formation of some clots which will be arresting the bleeding. So it will be closing up those pore spaces for the purpose of arresting the bleeding. So that is the first phase. Now moving to the second phase, which is cellular response. So under cellular response, we're just focusing much on the cells that are coming to the injured site to respond, to quicken the healing, to attack any bacteria that may have invaded, to eat up any dead tissue that may be on that injured site. So the first cells that arrive the injured site, we have the neutrophils. So the neutrophils have a lifespan of about 24 to 48 hours. So the neutrophils are going to be eating up the dead tissue, engulfing the bacteria. So they're just doing the same process of phagocytosis. So they're trying to clear up the area. So once these neutrophils run their lifespan within 48 hours, which is 2 days, we have the second cells that arrive the injured site. We have the monocytes. So monocytes are also going to be doing the same task that the neutrophils were doing. So the monocytes will not run their lifespan. They will mature into macrophages. So these macrophages will also begin to engulf. Those still keep on doing the same process of phagocytosis. They'll be eating up the bacteria, the dead tissue, and everything, clearing up the area. Not only that, we also have the lymphocytes. So we've got B lymphocytes, T lymphocytes. All these are in the duty of what? Throwing up some chemicals in case maybe the macrophages did not manage to engulf those bacteria. These lymphocytes will begin to throw those chemicals to do what? To destroy those bacteria and also labeling them. Yeah, not only that, we have the fifth type of cells that arrive the site. We have the eosinophils. So the eosinophils, these are in the duty of neutralizing histamine. They will neutralize histamine to reduce the inflammation. Not only that, we have also the basophils. The basophils, these are also in the duty of promoting inflammation. They are doing quite the opposite thing of the eosinophils. The eosinophils are neutralizing the histamine, while the basophils are promoting, are releasing more histamine. Yeah, so that is that on the cellular response. Once you mention these cells, you are done with the second phase. And then we move to the third phase, which is exudate formation. So under exudate formation, here it's all about just describing what exudate is. So you just say this is just the mixture of some fluids, of some dead tissue, and some bacteria. So once it's just that mix up of this fluid within the injured site, that is what we call exudate formation. Not only that, so we find that those cells have cleared up the area. Now it is clean. We don't have any bacteria. We don't have any dead tissue. The next phase that is going to follow, which is a healing phase, that is the last phase in the process of inflammation. So under healing phase, we are saying the area is clean. It has been cleared up by these cells that had come to invade the injured site. There will be formation of some new body tissue now. New tissue will be formed. So this can be quickened with the aid of good nutrition. If you eat food that are rich in proteins, vitamin C, at least there will be that quick healing whereby new tissue will be formed and new blood vessels will be formed, which we call it angiogenesis, which is the formation of new blood vessels. And then from there, healing is going to take place. So if the wound was small, we find that only a small scar will be left behind. And if the wound was big, there will be a wider scar which will be left behind, of which for that scar to disappear, it has to take some months, some years, and then the scar will be reduced. So these are the 4 phases that we have in the process of inflammation. You talk of vascular response, you move to cellular response, where you're going to talk much about the cells, and then you move to exudate formation, and then lastly, you talk about how the healing is going to take place, and then definitely inflammation is resolved. So that is all I had for you today. Thank you so much for your attention. I really appreciate. So you can share the video, like the video, download it, listen to it at your own free time so that you'll be able to learn. So thank you so much, team. I love you all. See you in the next video.